Did you know that 1 in 3 Singaporeans are estimated to have moderate to severe obstructive sleep apnea? Today, I'll be sharing with you the 7 signs of obstructive sleep apnea and how it can affect your life. Most people spend 1/3 of their lives sleeping. We sleep to provide rest and restore body's energy levels. Alterations in the quality, quantity, and pattern of sleep result in sleep disorders that can affect your physical and mental health. Now, lately there's been a lot of focus on sleep quality these days, and the modern epidemic of poor sleeping habits has been likened to the smoking epidemic of our parents' generation. The most common sleep-related breathing disorder is OSA, or obstructive sleep apnea. Now, it occurs when your throat muscles intermittently relax and block your airway during sleep. These muscles support structures including soft palate, tonsils, and the tongue. Now, when the muscles relax, your airway will narrow as you breathe in, hampering your breathing for 10 seconds or longer. This can reduce the oxygen level in your blood and cause a buildup of carbon dioxide. The brain detects it and briefly rouses you from sleep so that you reopen your airway. You awake with a shortness of breath that corrects itself within 1 or 2 deep breaths. And this is where you might make a snorting, choking, or gasping sound. And this can repeat 5 to 30 times or more each hour over the course of the whole night. So it's easy to see how this can impair your ability to reach a deep and restful state of sleep. People with obstructive sleep apnea might not even be aware of their interrupted sleep, and they might not realize that they haven't slept well all night. But the good news is, there are signs and symptoms of OSA that can be easily noticed. These symptoms include loud snoring, choking, or mouth breathing while asleep, waking up with a dry mouth or sore throat, excessive daytime sleepiness, morning headaches, mood changes such as depression or irritability, memory impairment, decreased concentration, and lastly, decreased libido. Obstructive sleep apnea can also lead to high blood pressure, stroke, heart disease, and other serious medical problems. Now, OSA is unfortunately quite common in children as well, but the difference is that children are more likely to have behavioral problems than the medical issues I just highlighted. So what that means is they might have difficulty paying attention or have learning problems in school. They may experience bedwetting or excessive sweating at night. And sometimes what parents perceive as laziness in their child might just be a serious case of OSA. Now, it's also important to note at this point that snoring might not necessarily indicate something chronically serious. It doesn't necessarily mean you have obstructive sleep apnea if you snore. So it's best to speak to an ear, nose, throat specialist, or ENT specialist as we like to call them, to go through a proper assessment and properly diagnose the root cause of your symptoms. So this assessment will usually be a 3 to 5 minute nasal endoscopy at the clinic, allowing the doctor to get a good view of your nasal and oral passages. So if the doctor notices significant obstruction, then a sleep study will be ordered to further verify the severity of your condition. Brain waves, eye movement, muscle activity, heart rate, and changes in your oxygen level are all monitored during this sleep study. So the good news is there are a bunch of treatment options for sleep apnea. And for mild OSA, a doctor might recommend something as simple as a change in diet or lifestyle, including exercise and weight loss, since being overweight is one of the leading causes of OSA. For moderate or severe OSA patients, they may consider using devices or surgical options. 2 types of therapies are commonly used, and the first one is continuous positive airway pressure machine, or the CPAP machine. It's commonly known as the Darth Vader machine because of the intense noise that it makes, but modern improvements have made that noise much more subtle. Another alternative is using a custom-made oral appliance designed to keep your throat down. And lastly, we have surgical options, which are for people who have extra or uneven tissues that block the airflow through their nose or throat, such as a deviated septum, swollen tonsils and adenoids, or something as simple as a small lower jaw that just causes your throat to be too narrow. Surgical options can sometimes be the most effective treatment for people who have OSA due to a surgically correctable obstruction in the airway. Now, I've said a ton for you to unpack in this video, But to conclude, if you have any of the symptoms I have mentioned earlier and want to consult a specialist but don't know where to start, well, then give us a shout. Go to our website, contact us, and we'll be more than happy to assist you with any questions you might have about OSA. That's all for today, and please remember to hit the subscribe button if you'd like to hear more interesting content from us. We're here to help, because at Premium Care, your health matters.